Endometriosis is a condition experienced by primarily women who menstruate, and the prevalence is about 1 in 10 experience this condition, which equals 190 million girls and women across the world. Endometriosis is defined by the growth of tissue that should be just in the uterus. It's tissue that's like the endometrium, but now it's growing outside of the uterus. And so that growth of the endometrium-like tissue is then associated with scarring, pain experienced during menstruation when someone is having their period, but also pain that occurs in their pelvis around other times. It can be very unpredictable. This particular study was a very large international collaboration. We took the data on more than 1 million genes, individual genes, for those participants, and trying to look at and identify what genes are related to, associated with endometriosis. And among this very large collaborative data set, we identified that there were 42 genes that were associated significantly with whether or not you had endometriosis. And we found that the genes associated with endometriosis also had a high likelihood of being associated with other pain conditions like migraine, back pain, multi-site chronic pain. We also found that these genes suggested a higher association with inflammatory and immune conditions such as asthma and osteoarthritis. And so these discoveries have opened up many new areas of investigation. This is another bit of evidence that endometriosis is not one homogeneous disease, that endometriosis has variation among patients, and better understanding the differences among patients will help us not only to better understand the biology and then maybe even get to forms of prevention of the disease, but it certainly will help us to better identify and target patients who are more likely to respond to certain treatments compared to others, and who they and their clinicians need to understand may be at different risks for future other symptoms and other conditions that can develop over time.